A very good afternoon. You're watching Lunchtime News on TV1. For the News First team, I'm Yuki Portia. Let's start off with a look at your headlines for this afternoon.
No walk-in or drive-through PCR and antigen tests. 500,000 doses of the Chinese Sinopharm vaccine to be brought to Sri Lanka tomorrow. Request to vaccinate all families of medical staff. Government to provide leasing concessions. Vegetable prices on the rise. Cloudy skies and showers exceeding 100 millimeters expected today.
Tomorrow will be a day where the general public of the country will have to be extremely cautious on how they act. The consequences of your actions will dictate the safety and health of your family as well as yourself. COVID-19 travel restrictions in the island will be relaxed tomorrow.
The government imposed travel restrictions across the island that will remain in effect from 11 p.m. on the 21st of this month until 4 a.m. tomorrow. Travel restrictions will come into effect again at 11 p.m. tomorrow and will remain in effect till 4 a.m. on the 28th.
Moving on, public transport services will not operate tomorrow. State Minister of Transport Dilum Amunugama said that this was decided at a meeting held yesterday.
Lockdown will be partially lifted tomorrow for the public to purchase essential goods from the store located closest to them. Therefore, there is no requirement for long-distance public transport to operate. Based on the guidelines from the National Operations Center for the Prevention of COVID-19 disease, we will have to limit the operation of the public transport. The functioning of buses that were deployed to the hospitals will continue. We will not operate any transport services to cater to passengers traveling long distances based on the instruction from the National Operations Center.
The Department of Railways has said that certain trains will operate when travel restrictions are lifted on the 25th of May to support the functioning of essential services. Accordingly, trains will operate between Ambepussa to Colombo Fort, Polgahawela to Kandy, Aludgama to Maradana, Kochikade to Colombo Fort, Avisawela to Colombo and Beliyatha to Induruwa.
The total number of confirmed cases of COVID-19 in Sri Lanka has increased to 164,201 after another 2,945 people tested positive yesterday. But 1,612 patients also recovered yesterday, raising the total number of recoveries to 128,607. 34,416 patients remain infected and are being treated at hospitals. Meanwhile, the Director General of Health Services confirmed 5 deaths that occurred yesterday due to COVID-19. Apart from that, 27 COVID-19 deaths that occurred between the 23rd of April and the 22nd of May were also confirmed. Accordingly, the total number of deaths due to COVID-19 infection in Sri Lanka is 1,210. Moving on, Director General of Health Services in a revised notice to the private hospitals and laboratories conducting PCR and COVID tests had stressed permission will not be granted for walk-in or drive-through testing. The Director General of Health Services has also informed hospitals that COVID-19 patients brought to a hospital must be admitted by the hospital within 15 to 30 minutes of arrival.
According to the guidelines, PCR tests at private hospitals and laboratories approved by the Ministry of Health must be conducted only on the recommendation of the consultant or medical officer in charge of the triage counter. It adds, after taking samples, the patient should be advised to isolate inside their home until the report is issued under the strict supervision of the respective hospital or laboratory. The guidelines issued by the Director General of Health Services also states that if a patient tests positive for COVID-19, it is the responsibility of the hospital or laboratory to inform the epidemiology unit of the Ministry of Health and the medical officer of health in charge of the respective area of the patient. It is also the duty of the hospital or laboratory to arrange the positive patients to be accommodated at an authorized COVID-19 treatment center. The guidelines also state that no walk-in or drive-through PCR or rapid antigen testing will be permitted.
Even
now, what we are attempting is to take the required measures to increase the capacity of PCR tests based on the requirement. We are not making attempts to decrease the PCR tests. We will continue to conduct PCR tests based on the requirement. Also, the capacity of conducting PCR tests will continuously be increased by the government.
රෝගීන් සංඛ්‍යාව අඩු කිරීමට අවශ්‍ය කරන ක්‍රියාවලිය වැඩි වැඩියෙන් ක්‍රියාත්මක කිරීම තමයි මේ මොහොතේ ඉතාමත්ම වැදගත් වෙන්නේ.
Meanwhile, the second batch of Sinopharm vaccine sent as a donation from China to Sri Lanka is due to be brought to the island tomorrow. Issuing a tweet, the Chinese embassy in Sri Lanka said that 500,000 Sinopharm vaccine doses and 502,400 syringes have been packed and delivered to the Beijing International Airport. Moving on, inoculation of the COVID-19 vaccine for the family members of the Government Medical Officers Association commenced today. Inoculation program commenced at 20 GMOA offices in the Western Province today. Accordingly, 5 family members of the GMOA representative are entitled to receive the vaccine. This is the manner in which the inoculation program was conducted at the Colombo National Hospital.
Yesterday, the Ministry of Health has taken steps to administer the vaccine to 5 relatives of a member of the Government Medical Officers Association in 20 MOH offices in the Western Province. Medical officers, nurses, additional and supplementary medical officers and junior medical staff are at the risk of contracting COVID-19. We object this decision taken by the Ministry of Health to only vaccinate the members of the GMOA and their family members. All professionals who are exposed to COVID-19 must be given the vaccine first. We believe that only after that, the relatives of the medical officers must be given the vaccine.
සෞඛ්‍ය සේවයේ අයවලුන්ගේ ඥාතීන්ට එන්නත් ලබා දීම කළ යුත්තේ කියලා අපි විශ්වාස කරනවා.
වෛද්‍යවරුන්ගේ මේ දක්වා මේ එන්නත් ලබා දෙන්නේ කාටද?
The final decision on who should get the vaccine is decided by the Expert Advisory Committee on Non-Communicable Diseases. So far, we are not aware of a change in the decision that has been made. Apart from the process of administering the second dose to those who already received the first dose, I am not aware of any special operation. Doctors are not the only group that are essential. Every health sector employee is important to us. According to my knowledge, the Ministry of Health has not implemented a special program to administer the vaccine to family members of doctors. If such a program is taking place, it must be available to all members of the health sector. We don't give privileges to any health sector employee. Exceptions have not been made to administer the vaccine to family members of doctors.
සාමාන්‍ය ක්‍රමවේදයෙන් ලබාගත් ක්‍රමවේදයෙන් පරිබාහිරව අපි මේ එන්නත් ලබා ගැනීමට මම කටයුතු කරලත් නැහැ.
We continuously requested for the health workers, nurses and their families to be inoculated. At this moment, they have started to inoculate the family members of the doctors by making a list. When we inquired from the ministry, what are they saying? We requested that all of these people be inoculated. However, no one has informed the ministry about this. Doctors are starting to hear about this only now. There are many drawbacks to this. We requested the Ministry of Health to adapt a more formal way. Our request is to inoculate the vaccine from the bottom level staff member to the topmost position. It is not the case either. Whoever can obtain the vaccine can administer. However, those who don't have access to the vaccine are left with nothing. Those who haven't received the vaccines are dying now.
The government has focused their attention on providing concessions to those who have obtained loans and leases from financial institutions.
The Presidential Task Force in charge of economic revival and poverty eradication said that a number of requests to look into the matter were received. The Presidential Task Force said they have focused their attention on the downfall of daily income of the general public and the adversities faced as a result in meeting leasing and loan premiums. The task force highlighted that discussions on the matter will be held with the Prime Minister, officials of the Ministry of Finance and the Central Bank, and a final decision will be reached.
Meanwhile, the Public Utilities Commission organized a blood donation drive at the Saragama Temple in Kurunegala today to increase the blood reserves of blood banks island-wide.
Electricians registered with the Public Utilities Commission and their families participated in this blood donation drive. Due to the current COVID-19 situation and travel restrictions, the stocks of blood at blood banks across the island has decreased. The Public Utilities Commission said this program is being implemented in all 25 districts of the country.
Now, vegetable prices at several economic centers were high today.
Vegetable prices are exorbitant. Beans are sold at 350 rupees. Tomatoes at 250 rupees. Leeks at 150 rupees. Carrots are being sold between 200 to 250 rupees. Prices are too high. We cannot buy anything. I didn't buy a single thing after renting a lorry and coming here from Ambalangoda. The Kapitipolo Economic Centre was crowded with traders and farmers today. The Dambulla Special Economic Centre was reopened today after it was closed down during the travel restrictions that were in place. Many traders and farmers were seen at the centre today. At present, 6.5 million to 7 million kilograms of produce has been transported to the economic centre. A large stock is expected to be received by noon. Even though a large number of businessmen gathered at the Tamuttegama Special Economic Centre, the supply of vegetables and fruits were low.
The Met Department predicts heavy showers of more than 100 millimeters in the western, Sabaragamu provinces as well as in some places in the Gaul, Mathura, Kandy and Norelia districts. The Department of Meteorology and Hydrology said that showers or thunder showers will occur at several places in the eastern and Uva provinces this afternoon or night.
Yes, Portia, we continue to report on the inclement weather conditions that Sri Lanka has been experiencing over the past few days with the onset of the southwestern monsoon. The Met Department forecasts these showery conditions will enhance during the coming days. Now, as far as the fishing community goes, according to our correspondents, many fishermen did not go out to sea. But there were some fishermen who did, and an incident was reported in Gaul where a group of fishermen had gone out to sea and a 16-year-old child is now missing. Of course, the caution that has been issued to the fishermen continues to remain, and fishermen, according to our correspondents, many of them did not go out to sea today. The National Building Research Organization has issued landslide warnings to be in effect in 5 districts of the country. Speaking of the flood situation in Sri Lanka, even before the onset of the southwestern monsoon winds, the Irrigation Department said that there could be a risk of floods in Sri Lanka in the coming days. However, according to the Irrigation Department, many reservoirs in the country under the purview of the Irrigation Department continue to be at a normal level. The water levels are at normal levels. However, there is a risk of floods at 5 river basins, especially centered around the western province. Now, there is one river which is a branch of the Kaluganga. The Kudaganga is at an alert level for floods. Meanwhile, spill gates of the Tabbova and Deduruoya have also been opened.
A sluice gate has been opened at the Kukuleganga Reservoir due to the inclement weather. The Director General at the Department of Irrigation and Water Management, STC Sugiswa, said 30 square meters of water is being released per second. He noted as a result there is a possibility of an increase in the water levels at the Kudaganga. Meanwhile, Pimbura in Kaluthara received the highest rainfall during the past 24 hours, with the rainfall in the area being recorded as 103 millimeters. The Centre for Disaster Management said Ahaliagoda in Ratnapura recorded a rainfall of 91.5 millimeters, while 85.5 millimeters of rainfall was recorded in Kegol during the past 24 hours.
Now, it has been revealed that the fire broke out on the Express Pearl ship carrying containers of nitric acid had ignited under the container deck. The Ministry of Ports and Shipping states that a team of experts from the Netherlands and Belgium had boarded the ship today.
එවගේම අද 11ට විශේෂයෙන්ම සූම් තාක්ෂණය මගින් ඒ නැවේ ඉන්න
A discussion is being carried out through Zoom by a team of experts, Sri Lanka Navy, Sri Lanka Ports Authority and everyone at the Harbour Masters Shipping Division. Moreover, preparations are underway to bring down a team of experts from the Netherlands with special equipment. We will hold discussions with the representatives of the insurance companies. We believe under the current circumstances the fire cannot spread because the required tugboats are there to douse the fire. We are prepared to douse the fire that erupts in certain locations.
යම් විදියකින් තනින් තන නැවත හට ගන්න තියෙනවා නම් අන්න එක නවත්තන්න තමයි අවශ්‍ය කටයුතු අපි සූදානම් කරන්නේ.
And with that, it's a wrap of Lunchtime News here on TV1. For the Newsfirst team, I'm Yuki Portia. We end today's bulletin with the Negatimu Sri Lanka theme song. Take care and stay safe.
Gammadda Negatimu Sri Lanka. Gammadda Negatimu Sri Lanka.